detergent spray. So when I go from place to place, kind of just, a little more than my hands.
Clean yourself up.
TexarkanaFYI.com and Horn Hog Radio with our good friend in Bowie County Health. You are our authority, Dr. Matt Young, and we want to get a COVID-19 update for Bowie County, and you're the boss.
Well, exactly. So we're social distancing here. We've got 6 feet between us, and just to make sure that we're covered and protected. So really, I mean, we are still in pandemic crisis mode.
Right.
Our levels of positive patients out in the community is at an all-time high. Our hospital capacity is at an all-time high, and not just here locally, but locally we are the hub for medical care.
Well, that's just it. So folks from Hope and like I told you before, I got up in the Cossatot River, got hurt, and this man said, you can't even get a good hamburger in between. So, everybody's coming to Texarkana for their medical care.
That's absolutely right. And so what we really have to do is remember, when the governor put the advisory out that we need to go back to 50% capacity at the restaurants and then hold off on our elective surgeries at the hospitals and make sure that we have the capacity for COVID, but also more importantly, wearing those masks, social distancing, and trying to be the best we can with good, strict hand cleaning, that we can decrease that spread.
And some recent studies have shown that a lot of people, we've talked about COVID, forget what we called it at the time, but just wore out from it.
Right, the COVID fatigue.
Yeah,
absolutely.
People are, I'm noticing in these studies where folks are like, yeah, we're still wearing our masks, but they have kind of slipped on, they're not using the hand sanitizer as often.
Absolutely.
Or even just washing it. And it takes all of those together to actually get some results.
And we've got to continue that, because what we do have to do is keep our emergency departments, our clinics open, where when somebody comes in, not only with COVID, but remember, motor vehicle collisions happen, heart attacks happen, strokes happen, people with medical and surgical emergencies happen every day that are non-COVID related. So that's the idea of holding off on the elective surgeries and making sure that our hospital capacity is available for other emergencies. And currently, there is room for those emergencies, but every day, actually every minute, it's getting squeezed, and it's tighter and tighter to make sure that we have capacity, we have the personnel.
Well, can I come out and say this? We're full up.
That's right, we are full up. And so with that said, when we say we are full, we will make room, and there's still room for you for your emergencies. But when it comes to the point of what can I do? What can I do not as a medical profession, but what can I do as a citizen? Well, I can mask up. I can make sure that if I'm exposed and told to quarantine, that I quarantine. And then again,
and that means really quarantine. That doesn't mean one last run to Walmart.
That's right.
There's a lot of services and resources around town that would help folks get anything they needed.
And our community is a great community. There's family and friends and other resources that can help us get what we need. And then soon, as we roll out the vaccination process, we're in stage 1B. So 1A, we've got most of our healthcare workers initiated. Most of us have had our second.
You've had your vaccine.
I've had my second vaccination.
What did you feel from it?
There's a little bit of soreness in the arm. That's not uncommon. Now,
well, sure, yeah,
some
with your
people,
flu shot, you get that.
Right. And anytime you inject something into that's foreign to your body, you're going to have a little reaction. But for us, a little bit of soreness in the arm, and there are ways to report if you have more serious reactions.
Have you had your second?
I've had my second.
Yeah.
Right. We're about 10 days into our second vaccination.
Was it the same with that, just soreness?
Soreness. Some people have had more of a reaction or more soreness after the second one, but fortunately, most of the people have not had.
I was told it didn't hurt as bad as the shingle shot.
Well, the flu shot and the shingle shots, again, are vaccinations that are foreign to the body, so we have reaction to those, and that's not uncommon.
So in stage 1B, what is that exactly?
Well, now, so we're starting to get the people that are 65 and older with other health conditions, and those that are 16 years or older with other health conditions. However, please be patient, because you have to remember that in Houston, in Dallas, in San Antonio, and
It's
Austin,
filtering down to us.
that's exactly right. I mean, we really love our community, but from the numbers aspect, we've got to wait until those vaccinations trickle down to us. And we're trying to do everything we can to communicate with our community who has them. But again, it's still slow coming, and it has been rolled out as fast as you can roll out a vaccination program, but still it's slow coming to our area. So everyone's asking every day, where can I get it? And we're working on trying to get those here. The clinics are working, the hospitals are working.
And I
The
know
Bowie
the health,
County Clinic.
the health over on 12th Street.
Correct.
They've had some there, and it's going to take a little bit of time.
That's right, and absolutely. And the same thing with, because we are a border town. The same thing with our Arkansas side. Miller County has worked very, very hard, and we work very hard with them. I can't say enough about those that work at the emergency operations centers, and what Judge Howell has done with Judge Harrison on the Arkansas side, and then our emergency managers, Chief Slaughter, and then Lance Hall with Bowie County, and then their counterpart on the Arkansas side, Joe Bennett with Miller County has done a great job. And then those professionals.
Great cast. I mean, everybody's really come together to do the best we can, and I think, and now we're starting to see it's a little bit easier to deal with. I mean, now there's kind of a routine when somebody comes in, how to get them booked in, how to get them taken care of, how to treat.
And we are getting some therapy for if somebody does have COVID but does not quite need hospitalization, to be able to get them medications through an infusion center at the local hospitals to be able to help them out, but also hopefully prevent them from having to be hospitalized. So we're really working very diligently as a community. And again, what we can do is to continue wearing our masks, continue trying to follow these orders as far as social distancing, the good strict hand washing. We have started seeing flu. So flu A and flu B, it's that season.
That's what I wanted to throw that in there too, because oh my gosh, social media, just people talking about, oh, where did the flu go? The flu's here. We've got flu. We've got 2 strains of flu that we've got going around. There's RSV, strep. There's all these other things. So yes, the numbers are lower. We have seen that lower numbers, but and I think it's because of the masking and the social distance.
That's absolutely correct, because we don't normally do that during flu season. We don't normally mask, and that's the majority of the time where we pick up these infectious processes, be it a virus or a bacteria. It's usually through the nasal passage or the mouth, or picking something up on our hands and getting it in our eyes or nose or mouth. And so with the mask on, it has at least decreased the amount of spreadability of both flu, strep, RSV, but they're here. And we've got to be careful, because those can be just as deadly.
And that's kind of what I'm getting at. I mean, that's with us being full at capacity and these other seats. Please, we need to put in some more effort, I think.
Well,
as much as you can.
Everybody's got COVID fatigue, and we all understand it.
Sick of hearing about it, sick of being scared of it, but it is real. We are at capacity. Let's take it serious for a little while longer. The vaccinations are rolling out. And do you think, at what point will just general public be available here, do you think? I know it's hard to guess on that, because they do go to these bigger cities first, and then we get what they send.
I hope towards the end of March, 1st of April, we can really start getting the general public. But we're working very hard when we do get vaccinations here in our local areas to make sure they don't go wasted. That's the last thing we want to do. So we want to put those shots in the arms to make sure that somebody who shows up in the right category gets it, and just be on the lookout. We'll get some information out there. We're all working together as a community, all the local healthcare facilities, all the local providers, and then of course, our health clinics are doing the best they can.
Mm-hmm. And Miss Brooke, she's doing really well too.
That's right. Today's Brooke's birthday.
Happy birthday, Brooke.
We're happy to have her.
We're not singing.
She does a great job here to make sure that we're all available for the community and to be able to get out education and to make sure that we can also get out the information.
That's what I wanted to throw in there. Everybody, reach out if you've got questions. Call the city.
That's right. And then the Emergency Operations Center, Lisa Thompson and Tracy Litton have done a great job there.
Yeah, they get the information. They keep it posted at coronatxk.org.
And you can go on there and look and see the capacity of the hospitals as well.
Right.
I mean, that's not anything that is public knowledge. And when I say that, being the healthcare hub for our region, we're in a region larger on the Texas side that includes all the way up to Paris, Titus County.
Mm-hmm.
And so those hospitals are at capacity too. And so it's a daily and hourly and minute wise almost procedure to make sure that we have capabilities and capacities for any emergency, be it COVID, but we're at capacity and we just need to make sure that we can do our part as a citizen to decrease the spread. And right now, we've had the most cases we've ever had, and there's a prediction that we've not even seen the peak yet. So
Right.
We've got to do what we can.
Well, Doc, I thank you for your time, and Miss Brooke making time for him to talk to us. So thank you very much.
Yes, Jeff, we appreciate you getting this out to the
I'm gonna check
community
back
and everyone.
in with you, and if anything comes up, you let us know. And if we need to like sing a birthday song for Brooke, not a problem. We can do that anytime.
All righty, thank you.